Anytime outside today, you probably felt the impact of the poor air quality firsthand.
Yes, the smoke blowing in from wildfires burning in surrounding states, paired with the heat wave, it's all making for hazardous conditions here and across the state. ABC4's Jillian Smuckler spoke with a pulmonary physician at Intermountain Healthcare.
She joins us now live to explain how the air pollution is affecting not just those with underlying health conditions, but anyone who breathes it. Jillian.
Glenn, Emily, Salt Lake County air mixed into the unhealthy category several times this afternoon. And now health experts are asking Utahns to limit their time spent outside and to monitor for any adverse reactions to these dangerous conditions.
The biggest thing to keep in mind is air pollution affects all of us.
During the summertime, there's two major types of air pollution that Utahns are faced with. The first is ozone pollution, and the second is particulate matter.
It is unusual in that it's really quite a lot of air pollution. It's also unfortunately something that seems to be happening with some regularity.
Utahns are used to hearing about particulate matter during our winter inversion. But now, with wildfires raging across the west, it's also become a summer threat. When particulates enter your lungs, you can feel immediate effects like wheezing, coughing, and difficulty taking deep breaths. But aside from the direct inflammation,
beyond the lungs, those really fine particles then go from the lungs into the bloodstream. And then they're all over the body. And that's when you get effects of air pollution that we don't often think of, right?
That's why this pollution poses a huge health risk. There's an increased risk of clotting, strokes, heart attacks, and heart failure.
So air pollution is bad for everybody. So if you are a young, healthy person, no medical problems, no issues ever, and you don't have any symptoms when you breathe the air pollution, it is still bad for you. Your risk of premature death or lung cancer or developing lung or heart disease is higher.
While children, the elderly population, and anyone with underlying heart or lung disease are especially sensitive to it,
just going out into the air, they'll feel it right away.
Anyone who's exposed for an extended period of time is subject to getting sick.
And there will be some period of days that the exposure builds up enough and that you've tried the things you would normally do at home and see if you're getting better, that you're not. And
so just how dangerous is the air we're breathing?
20 to 55 or so range is in the range of 1 to 2 cigarettes a day for moderate air pollution. So pretty significant over a period of time.
That's why Utahns are encouraged to take it easy while these conditions continue.
Doing all the things that we love to do because it's summer and we want to be outdoors. Those are the things that right now when the air pollution is high, you really want to be exercising indoors.
It's important to keep in mind that air pollution increases the risk of infection. And recently, there's been a spike in COVID-19 cases among unvaccinated people. So the race to vaccinate as these smoky and hot conditions continue is more important than ever before. Reporting live in Salt Lake City, Jillian Smuckler, ABC4 News.